Anne Barker, ABC News.
Well, while the world is focused on the virus, health experts and NGOs are still grappling with how to respond to other diseases in vulnerable communities, including the Asia Pacific. Ironically, vaccination programs have been stopped, apparently for everyone's safety, and many are worried that aid funding will dry up as donors shift their money to quell the financial chaos COVID-19 has brought with it. I'm joined now by Tracy Yuen. She's a health advisor with ChildFund Australia and has worked in biomedical research, which includes designing vaccines. So, Tracy, really interesting to get your perspective on this. Was there no other choice but to stop these programs during this pandemic?
Yeah, I think it's been a really tough decision for governments to make and for the World Health Organization to make this recommendation to halt vaccination programs. But just out of, the sheer safety of our frontline workers who would be delivering those vaccines, as well as making sure that communities don't congregate in groups where there would be increased risk of spread of COVID. Yes, it is necessary, unfortunately.
And what is the kind of critical time frame, in your view, to have it stop the spread, but then get back on with very important work?
Well, we're pretty much on standby, just waiting for the opportunity where we can, kickstart these programs again. I think it really depends on a case-by-case basis with the countries, depending on caseload, how well they're handling the pandemic, and really just waiting for those opportunities where we can get back on there. So our health volunteers are already keeping lists of children who would otherwise, who are scheduled for their vaccines and who can't receive them at the moment, so that when we can go out there, we already have a list of those kids.
Countries in the Pacific that are heavily impacted, say, by TB, how critical is the time frame in terms of getting the people vaccinated to stay on top of the spread of TB?
With TB, some of our neighbouring countries like PNG have had ongoing challenges in managing it. Not only regular TB, but also drug-resistant TB. I think one of the challenges that COVID-19 has brought is, with TB, it's twofold. One is that drug supplies are currently halted. So with a lot of flights being grounded, we've had a lot of those shipments stuck at airports in Asia, unable to get into the country. And so now there's national shortages of a lot of drug supplies for treating TB patients. And because the treatment regime for TB is so long, it's 6 months or more, this can really jeopardize the gains that we've made in TB control, and it can also increase the risk of developing drug-resistant tuberculosis.
How concerned are you about this bun fight over the funding to the World Health Organization?
Sorry, could you repeat that again?
How concerned are you about funding questions around the World Health Organization?
I think anyone in public health at the moment would be concerned. It is a worry. It's a big chunk of money that has been cut from their budgets with current geopolitical issues. I think WHO does a great job on a shoestring budget already, and to cut that even further is really jeopardizing a lot of the programs going forward.
Let's talk a little bit about COVID-19, and of course everyone is now chasing a possible vaccine. Do you think it's a positive in a way to bring renewed focus on the importance of developing vaccines?
Oh, it's been a really interesting time. Vaccines have often been relegated to universities and research institutes, and it's not really a sexy topic for research. But with COVID, it's, brought the spotlight to it. It's got all of the best minds in the world working on it. And this idea that we can come out with a vaccine in 12 to 18 months is really unheard of. So it's amazing to have this renewed interest, and I hope it continues in the future as well. And
what do you think their chances of success are, given your medical background?
I think there's challenges. I mean, with the SARS vaccine as well, when they were developing that, there was a number of different challenges. Be interesting to see what happens now with COVID. I think there's so many great minds working on it. I'm really rooting for them to succeed. But let's see. It's still very early days.
Tracy, let's hope you can get back to the programs you're focusing on in the Pacific. Thanks for joining us.
Thank you very much.